Frontline workers, 2 parents and children, many are struggling with COVID-19's toll on their mental health. Fox 24's Lauren Kraycall shares with us the day-to-day challenges these people are facing and sheds light on how they've learned to manage.
Those battling the front lines are facing 2 deadly situations: the COVID-19 pandemic and a decline in mental health.
I know several people have started medications.
ICU nurse Megan Berry says the virus resurfaced mental health issues she thought she'd overcome.
But COVID kind of brought up some of those symptoms that I haven't had for 5 or 6 years.
She says her coworkers are also struggling.
A lot of them have had new anxiety, new depression, or kind of like reoccurrences of old episodes of anxiety or depression.
Berry says working the front lines, death is no stranger, but COVID-19's casualties have been harder to face.
It's almost every day that you have a patient that really gets to you, so you just have no time to catch your breath and recover and process it all. So it's just really, really exhausting.
This battle being fought in hospitals and in homes.
Here, we've all lost our tempers. We've all had really, really hard times.
Lori Lynn Tucker has 3 children, all under the age of 7. From managing work while being stuck at home together.
No, ma'am, we're not going to play with that.
To the everyday challenges that come with being a mom.
This year has been a struggle.
The mental strain of this virus also affecting her oldest son.
It's just now realizing how hard that has been on him, even though he hasn't had the vocabulary to share exactly what's going on in his head.
This coming as no surprise to licensed psychologist Dr. Shelley Farnan.
From our kiddos up to our grandparents and everyone in between, our mental health has been impacted. We've seen a rise in referrals, a rise in our crisis services needs and calls into our crisis services. So all of those things are increasing.
When it comes to coping with the struggles of mental health, aside from seeking therapy, Berry says not stretching herself thin while working long hours has kept her going. For Tucker, finding joy in the little things is keeping her family afloat. But Dr. Farnan says it can be as simple as just checking in with ourselves.
We have to pause and honor how it is that our bodies are feeling and really invest and be intentional in that.
Dr. Farnan says one positive thing: COVID-19 is elevating conversations surrounding mental health.
And now this year, employers have to think of this because it's impacting our employees. So it's requiring us to talk about mental health in all of our spaces.
Something those wearing many hats at home.
We can't do this alone. We are better in community. I hope we can take that forward. I do think that is important to the mental health of parents and children.
And those dressing out in scrubs.
It's helped me to see a therapist. I think you need a professional to work through some of the stuff we've seen.
Are grateful for.
The whole world has been through a traumatic event. And if we don't process this trauma, it will lead to more trauma.
I hate that we've had to go through this, but I am glad that it's brought some things to the forefront of our minds that aren't always there.
If you or someone you know is struggling with their mental health, we have a list of resources, phone numbers, and services available on our website. That's fox24news.tv. Reporting in our Rogers studio, Lauren Kraycall, Fox 24 News.
Now, Lauren, thank you for that. We've always said it. It's a tough conversation to have, but one that is needed.